Hi, I'm Pete. I'm one of the paramedics with Suffolk Accident Rescue Service. I'm working with Dr. Ben Pearce today. We'd just like to give you a demonstration of some of the skills we can bring to scene. So to set the scene, we've been called by the local ambulance service to support them with a patient who's had a fall from a ladder and sustained a head injury. They want us to help look after the patient's airway and get them safely to a major trauma centre.
So the procedure demonstrated here is termed an RSI. It's an emergency anaesthetic that we deliver outside of the hospital setting for a patient who's critically unwell. You can see here that we have a specialised kit bag that enables us to have all the equipment in the correct place, close at hand to do the procedure. We do some checks beforehand that you've just demonstrated to ensure that the safety of the procedure is as equivalent to the safety of performing the procedure in an operating theatre in a hospital as possible. You can see here that Pete is giving the powerful anaesthetic drugs, the same as those used in hospital, to put the patient to sleep and to allow them to tolerate the procedure that you'll see happening shortly, which is inserting the breathing tube into the patient's windpipe to take over their breathing. So at this point we're just waiting for the drugs to work, and you can see us starting the procedure to insert the breathing tube here. We use a small flexible catheter first, and the breathing tube there goes over the top into the patient's windpipe, into their lungs. It's important we perform and complete this procedure promptly to make sure that we take over the patient's breathing promptly and their oxygen levels do not drop whilst the anaesthetic drugs are taking effect. Now the tube is in the correct position. You can see us just checking it there, using the monitor that we have with every patient we attend, and also looking at the patient's chest rising and falling. You can see Pete here helping me tie the tube in position to make sure it doesn't move. And after we've completed this, we'll attach the patient up to a portable ventilator, and that will continue to take over the patient's breathing for their transfer to the hospital.
Thanks for watching. Hopefully it's given you a bit of an insight into some of the skills and support we can bring to the ambulance service at scenes of accidents. If you'd like any more information on the work we do or the charity, then please head to www.sars999.org.uk. Thank you.